Good morning, Miss. My name is Angelina Ramoriosa, and I will be demonstrating on the donning and doffing of personal protective equipment, or the PPE. According to the FLSA, donning refers to the putting on, and doffing refers to the taking off of the PPE. So, as for the donning, it must be done before entering the patient's room. As for the doffing, everything must be removed or must be doffed at the patient's doorway except the respirator mask. It is mainly to avoid contamination. So, in the first procedure, we will be performing hand hygiene or wash our hands. This is mainly to avoid contaminating the materials. Second is to gather the materials to have a continuous flow of the procedure. So the first procedure of donning our PPE is to perform hand hygiene or use an alcohol-based sanitizer as we have here. This is mainly to prevent contamination from the microorganisms acquired during preparing of the materials. Second is to don our shoe cover. So upon donning our shoe covers, we need to make sure that all of the areas of the foot are covered and that the shoe covers are snug over our ankles and cuff. This is main this is to completely block the microorganisms from entering. Next is to don our gowns, and we need to make sure that we should full cover from torso, full cover the torso from neck to the knees, arms to the wrist, and wrapped around our back. This is mainly to prevent the contamination or the entering of microorganisms, since these parts are most exposed. So as you can see, my PPE is very big, miss, because I am a small person. Next is to don our mask. So we need to full cover our face. This is mainly to prevent it from falling or from dropping down. Since I do not have the mask that is fit for the PPE, I will improvise using a surgical mask. So next, after the mask, is to don our eye shield. This is to protect our eyes from our hands from touching it, since there will be time that our eyes will be itchy. So this is mainly to protect our eyes, especially when we are in close contact with the patient. So this is probably not the fit goggles for the PPE, but since I do not have time to buy for it, I will improvise using the available equipments. So next is to don our bonnet. So this is mainly to avoid touching our hair and avoid our hair from falling down. This is mainly to avoid touching the hair. To We must place the bonnet and adjust its fit to the to to our head or to our hair. So next is to don our face shield. This is also to protect our eyes and the entire face. Um, we must place it over the face and adjust its fit. This is to avoid direct touching of the face and to protect it, especially from coughs. So this serves as our barrier from the coughs of the patient. Next is to don our gloves. We must extend it to cover the wrist of two isolation gloves. This is mainly to avoid the exposure and touching of our skins, especially in this area or about the hands. So it is advisable in, to enclose the ends of the gown to the gloves so that our skin or a slight exposure of our skin will be prevented. So that is it for donning our PPE. Yes. So when doffing for our PPE, the first procedure is to doff our shoe cover. So we must grasp the edge of the shoes of the shoe cover, the outside of the shoe cover, and pull it down our ankle like this. And we must dispose it properly. So pulling away prevents decontamination from soil and dirt. So next is to doff the first layer of the gloves after performing our hand hygiene. This is mainly to prevent the transmission of microorganisms to the other parts of our PPE. So after removing the first layer of the gloves, we must perform hand hygiene. Next is to doff face shield. So we must touch the sides of the face shield. So this this is mainly because the side has lesser exposure to the when facing a patient. So next is to doff the gown together with the last layer of the glove. So first is to unzip the gown, and then pull down from neck. We must be careful that it will not be in close contact with our clothing. So pull down from the neck um, and shoulders, touching the inside of the gown only. So next is to turn gown inside and out, and roll it into a bundle and discard it into a waste container. This is mainly to avoid the contact with the outside of the gloves and the outside of the gown that are exposed. We'll be disposing it here, our bin. Next is to doff our bonnet. This is to remove from the inner back to the front. Make sure not to touch the outside layer of the bonnet. This is mainly not to touch or contaminate the face, since our face is more sensitive. Next is to doff our goggles. So you must remove the goggles from the back, lifting the headband or the earpiece. So back part of the goggles has lesser exposure since it was protected by our bonnet. So next is to doff our mask, touching the sides of the mask, the elastic part, and because grasping of the elastic part is the proper way of removing the mask, as per said by the protocol, because the front part of the mask has too much exposure, then it has a lot of microorganisms present. And lastly is to perform hand hygiene. Of course, this is to prevent the contamination, or we can use an alcohol-based sanitizer. So for the post-procedure activity, we have the aftercare. So this is mainly to promote a clean environment conducive to health. Next is to wash our hands, of course, to prevent transmission and to sanitize and for the hygiene purposes. So in the attitude of the student, we have the assumes accountability to improve nursing care or to improve our skills. Lastly is to assume accountability to prevent the repetition of mistakes. Thank you, Miss.